to talk to Shadow Justice Secretary Steve Reed. Morning, Steve.
Good morning, Kevin.
Thank you very much for joining us at this ungodly hour.
Pleasure.
Can we talk about the NHS? A very alarming announcement yesterday that the junior doctors and the consultants will, for the first time, coordinate industrial action over the next couple of months, a few days in September, a few days in October. Now, this is really, really concerning, is it not? Because patients are going to suffer because of this, and frankly, let's not beat about the bush, patients will die because of this. A solution to this industrial dispute between consultants, junior doctors and the government is an imperative, isn't it?
Well, you're absolutely right. It's incredibly worrying, particularly for people who are in those ever-lengthening waiting lists for NHS treatment. But I guess we have to look at why this is happening, because we've had years now of underfunding of our National Health Service. The professionals who work in those services have seen their pay in real terms go down by around a third. The condition of the buildings as well. We've got hospitals where concrete is falling off the roofs and staff and patients don't feel safe in there. Now, what the government should be doing is bringing everyone together, the junior doctors, the consultants, and sitting down and trying to negotiate a way through this. This is in the interests of the public and of patients. It's what the health professionals want as well. They've been calling for it. They haven't suddenly decided they don't care for patients anymore. They've dedicated their lives to caring for people who are sick. They want to get on and do their jobs as well. But the government is refusing to get everyone round the table. I mean, it's astonishing. But my colleague Wes Streeting, the Shadow Health Secretary, found out a few days ago that it's 5 months since the government spoke to the representatives of NHS consultants. 5 months. They should be sitting everybody down and finding a way through this, because nobody wants to see these strikes taking place.
Absolutely. Now, Labour's been doing some sterling work going through the statistics in the last few days, and I think it was 2 days ago, it might have been 3 too, you released these really, really shocking figures that last week alone, when the consultants walked out on Thursday and Friday, that caused 45,000 surgeries, operations, both, all pretty urgent, to be cancelled. And then going back to December, when the medical strikes really started to hit hard, that since then, 885,000 operations have been cancelled due to these strikes. I mean, this is frankly dysfunctional and absolutely unacceptable, isn't it?
Well, it's staggering, and you've given the statistics there. We dug them out, and you very kindly repeated those figures there. I mean, people that are waiting for treatment on the NHS, many of them will know how long you have to wait now, because those waiting lists are getting longer and longer. But the issue is, why is the Prime Minister, now Downing Street's just down the road behind me, why is the Prime Minister standing outside number 10 making whatever signs with his hands rather than getting in there and sorting out this problem? He needs to get a grip. He needs to get the consultants, the junior doctors around the table and start to negotiate a way through this problem. There always is a negotiated solution to a problem like this. In the end, that is what will happen. But the longer the Prime Minister just stands there, arms folded, doing nothing, the more patients will suffer in the way that those statistics you just talked about are telling us.
Here's another statistic that Labour dug up, and that is that over the past year, there's a macabre, this isn't Labour, but I know that in the NHS there's a macabre nickname for the waiting lists, which of course are way over 7 million. They're called the death lists, because last year 60,000 people died while waiting for treatment for the NHS. This past year, 120,000. That's doubled. So this is absolutely shocking, isn't it?
Well, it's absolutely shocking, but this is what happens if you have a government that spends 13 years underfunding the National Health Service, downgrading the pay of the professionals that work in those services. I mean, you'll have seen, like I've seen stories in the papers, younger doctors, health professionals are getting jobs in other countries like Australia, having been trained here, rather than working in our NHS because of the dilapidated state of so many of our hospitals, the huge waiting lists, not just for hospitals, but to see a GP. I was speaking to a GP in my constituency just a couple of weeks ago who was telling me you just get 5 minutes with each patient now, and many of those cases are over the phone, so you're not sitting down speaking to the patients anymore. They've degraded health services in this country, this government, over 13 years. And the only way we're going to get change, I'm afraid, is by the election of a different government. But right here and right now, we need to be doing everything we can. The government needs to be doing everything they can to stop these strikes that are going to make those waiting lists get even worse. The health professionals don't want to strike. They want to talk, but the government is refusing to open the door, get everyone around the table and get those conversations going that can start to show us a way through the crisis.
And another of Labour's statistical discoveries has been that patients across England last year waited a total of 5.4 million hours in A&E, accident and emergency, while experiencing mental health crises last year. And one patient you have found out about was a patient at Epsom and St Helier University Hospitals, that's down there in South London, waited 278 hours, that's 12 days, to receive treatment in accident and, quotes, emergency. 278 hours to see someone with an emergency. That doesn't ring right, does it?
Well, I mean, it's almost hard to believe, isn't it? You can't believe
yes.
Somebody went to A&E for emergency treatment and they were left for 12 days, not 12 hours, waiting in A&E with a mental health crisis, and there was nobody to see them because the professionals aren't there, because the government hasn't been funding them. Now, what Labour is proposing that we need to do is we need to recruit additional mental health workers, and we can do that. We can find the money by closing. There's a tax loophole used by private equity funds that would raise half a billion pounds, and we can take some of the money that would be raised by imposing VAT on private schools. That would raise the £1 billion necessary to fund 8,000 additional mental health workers who could be operating in our A&E units in our hospitals, but also give access to mental health in every school up and down the country. And the earlier that you get an illness like mental health, the more that you can prevent problems turning into crises that cost much more for the public purse, but also lead to much more damage to an individual's life. But the fact that anyone waited for 12 days in an A&E should shame the government, and it really does tell us the state of disrepair and dereliction that our National Health Service is in today.
Can you promise us, Steve, that you talk about, we need more funding for the NHS, and often you give the NHS more money, you might as well chuck it into a money pit and set fire to it. It gets 200 billion quid already, but, you know, I'll take your point. You think it needs more funding, but can we get a promise from Labour? Because we all know that the NHS is a very unwieldy, disorganised organisation that spends money left, right and centre where it doesn't have to. There are far too many middle managers on £150,000 a year or more doing jobs you can hardly work out what they are. So, yes, if you say so, give them more funding, but organise the money you've got better. Will Labour do that?
Well, I mean, I don't think it is just about funding, actually. You know, we've had serial underfunding for a long time, but it's not just about the level of the quantum of money that's going in. I think we need, you know, my colleague Wes Streeting, the Shadow Health Secretary, and Keir Starmer, the leader of the Labour Party, have both been speaking a lot over recent months about the need to shift towards a more preventive model. So you get a problem early and you deal with it early, then it doesn't become a health crisis. It's better for the individual, but it actually costs us less as well. And there's a lot more you could do to intervene early and deal with those problems. So what I was just saying about that, that funded proposal to get those additional 8,000 mental health workers. By having them placed in schools and hubs in communities, you can catch these problems earlier, and it's cheaper to deal with them when they're a much lower level issue for individuals than when they become a mental health crisis. I've got personal experience of this in my own family as well. We lost my father last year, but for the couple of years leading up to his death, he developed a form of psychosis and dementia, but the support he needed wasn't around. So his condition became much, much, much worse and caused much more problems for my family, particularly my mum, who was left there as his carer. And had support been available earlier, then the crisis he ended up in later on in his life wouldn't have happened, and it might have been cheaper to deal with as well as far fairer for him. And that happens to families up and down the country.
I was going to say, I'm very sorry to hear that, but it's a story that's all too familiar with a lot of people around the country. So sympathy for that, Steve. Can I just ask you, moving on, we've got this extraordinary situation with the schools. Now, a couple of days ago, we were told, 11 schools might have to close because they were built with concrete's answer to chocolate aero bars back in the 70s. This is not safe material. Now we're hearing, the Sun is saying 150 schools might have to close, or even more. Now, Schools Minister Nick Gibb, who's coming on later, he has told another channel this morning that he doesn't know how many schools will have to shut completely because not all the surveys have been completed. We're hearing that warnings were sounded about this 5 years ago, but we are now on the brink, possibly, Steve, of, I've worked it out, possibly, 100,000, 150,000 school kids are going to be told, you're not going to school at the start of the term. What do we do with them? As the Telegraph says today, this is the same as the lockdowns. Kids being prevented from getting the education that they should get. This is a disaster.
Well, can you imagine how furious, frustrated, angry parents are going to be feeling just days before the start of the school term, that their school isn't opening and their kids may not be getting the education they need? After all the disruption we've had as well, during the pandemic, during the strikes that were happening earlier in the year as well, parents exhausted after the long summer holidays, and now to be told that their kids aren't going to school because the government is so incompetent and inept that they haven't done anything about a problem that they've known about for at least 5 years. You say you've got Nick Gibb, the Schools Minister, coming onto your programme. I mean, what I'd like to ask Nick Gibb is, why did he scrap, when he first became a minister back in 2010, why did he scrap the school rebuilding programme that was in place that would have dealt with this and put nothing else in place to replace it? Back in 2018, as you said, 5 years ago, there was a school in Kent where the roof collapsed because it had this kind of reinforced aerated concrete. It collapsed, so you couldn't have had a starker warning that this was a problem. The National Audit Office has told the government it's a problem. The Department for Education itself was telling the government last year that the situation was now critical. My colleague Bridget Phillipson, who's the Shadow Secretary of State for Education, has asked questions in Parliament 150 times.
Really?
150 times over the last 2 years, and yet the government hasn't done anything at all. They could have started putting measures in place at the beginning of the summer holidays, alerting parents and making sure that there were alternative spaces for these kids to go and get their education next week when they're back at school. But instead of that, they've left it until days before the start of term. It is inept, it is incompetent, and it is negligent. And the entire problem is because the government did not act on warnings that were as visible to them as they were visible to me.
Steve Reid, thank you so much for the time. Good to talk to you. That was Steve Reid, Shadow Justice Secretary there.